In today's world, treatment of a tumor of cancer is not just about removing the disease. It's also about giving a good quality of life to the patient. And one of the main factors or aspects in which a good quality of life can be given is giving good cosmesis. And good cosmesis can be achieved by having incisions which are smaller or incisions which are hidden. So mini incisions or hidden incisions are used in head and neck surgery in today so that we can reduce the scars on the face and the neck. Some of the organs that can or surgeries that can be performed by the mini incision or a remote incision are: one is the thyroid gland. So the usual thyroid gland incision would be about 5 to 6 centimeters in the neck, in the lower part of the neck. The incisions have been reduced now to a smaller size, again in the front of the neck, or you can have a remote or a hidden incision behind the ear or from the chest. And when these incisions are used from behind the ear or chest, you may also require the use of a robo or an endoscope to deliver this disease. The next organ which is commonly used with a mini incision is a parathyroid gland. So these are glands which are there on the side of thyroid, which may need to be removed in certain conditions of increased parathormone production or in case of an adenoma. Again, small incisions or mini incisions are used. Even endoscope is used to guide us to ensure that removal of these glands can be performed with these small incisions. Another area where a mini incision is used by me is in the parotid. The normal parotid incision being a large incision from the face onto the neck. Our technique is to perform this surgery with a 2 to 3 centimeter small incision just behind the ear, behind the ear lobule. So this incision is hidden behind the ear and is not seen at all. Why is there a need for this mini incision? Well, cosmesis being the first thing. People want a smaller scar. If they want a smaller scar for the abdomen, where most of the areas can be covered, I'm sure people want a small scar in the neck. Everybody wants a laparoscopic surgery or a small incision surgery in the abdomen, which can be covered by dress. But yes, so smaller incision can also be done in the neck. So the small incision is all about cosmesis. Secondly, in many cases, the smaller incisions can also be can lead to small or reduced tissue dissection. That is how much of tissue we are going to touch while surgery. And the small amount of tissue dissection can lead to better healing, faster healing, reduced stay in hospital, and good recovery and quality of life. That's the other advantage of having a mini incision in the neck.